du jour.
Private members business, private members motion. Commencement du débat sur la motion de Monsieur Angus.
Initial debate on motion in the name of Mr. Angus, M 456, on palliative and end-of-life care strategy.
Mr. Angus, seconded by Madame Moore, Abitibi Timmins-James, moves that in the opinion of the House, the government should establish a pan-Canadian palliative and end-of-life care strategy by working with provinces and territories on a flexible, integrated model of palliative care that tient compte
takes into account the geographic, regional and cultural diversity of urban and rural Canada. B, respects the cultural, spiritual and family needs of Canada's First Nation, Inuit and Métis people. And
of one, ensuring all Canadians have access to high-quality, home-based and hospice palliative end-of-life care. 2, providing more support for caregivers. 3, improving the quality and consistency of home and hospice palliative end-of-life care in Canada. And 4, encouraging Canadians to discuss and plan for end-of-life care. Debate, the honourable member for Timmins-James Bay.
Thank you, Mr. Speaker. It is always a great honour to rise in this House representing the people of Timmins-James Bay, and tonight I'm particularly proud to represent the New Democratic Party as we bring forward a motion that we believe is very essential for the development of long-term planning for health in this country, which is a pan-Canadian strategy for palliative care. Je suis très fier d'être ici ce soir.
I'm very proud to be here this evening to speak to this motion on behalf of the NDP to call on the federal government and the Parliament of Canada to adopt a pan-Canadian strategy to ensure access to palliative care and to work with the provinces and the federal government to ensure that there is quality of services provided.
To make a few notes, I'd like to, for the people watching across Canada, I'd like to thank the support that we've received from medical leaders, medical organizations, the frontline service providers who are serving people in need, the social workers, the pharmacists, the nurses, the doctors. I'd like to thank members of the various spiritual communities of Canada who've supported the New Democrats in this motion. I'd like to also, at the beginning, on a personal note, mention my late brother-in-law, John King, who was a close friend and a brilliant young man who lost his life much too early to cancer. And just after the 2008 election, I came home after that election and spent the last few nights with John at Parham House in Toronto. Parham House was an extraordinary palliative care centre, and at the time I thought that that was the norm. I thought that when Canadians became sick, there were Parham Houses everywhere. And it was after Parham House closed, and there was, again, in the city of Toronto where my brother-in-law was dying, the lack of good quality palliative care beds. Certainly there are good quality palliative care in hospitals, but community-centered, spiritual-centered, communal, familial-centered, it made me begin to realize that across this country we don't have a standard form for ensuring that families and individuals have the support they need. I'd like to also, at the outset, Mr. Speaker, thank the incredible work of the All-Party Committee. The Parliament of Canada is now known as a relatively toxic place at most times, but members of all parties came together on this vital issue and worked hard. And I recognize the members of the Conservative, Liberal and New Democrat parties who worked on that motion, or worked on that study, and wanted to bring forward to Parliament the need for us to establish this pan-Canadian strategy on palliative care. And I believe that the motion that I'm bringing forward on behalf of the New Democratic Party is carrying forward the work of this all-party committee. And one of their key recommendations, Mr. Speaker, was that we, the committee, strongly urge that the federal government re-establish a palliative care secretariat for the sake of developing and implementing a national palliative and end-of-life care strategy. So in honor of the work that my colleagues and the other parties and the Democrats did on that committee, we're bringing forward that motion tonight. I'd like to also, Mr. Speaker, there's been much discussion lately in the media, and many terms are being used in terms of the issue of dying with dignity and what it means, and people are grappling with very complex and emotional issues that touch all of us. I'd like to use tonight the example or the definition of palliative care that has been offered by the Canadian Medical Association. The Canadian Medical Association tell us that palliative care is an approach that improves the quality of life of patients and their families facing the problems associated with life-threatening illness through the prevention and the relief of suffering by means of early identification, assessment and treatment of pain and other symptoms, physical, psychosocial, and spiritual. What we see from the Canadian Medical Association's definition, Mr. Speaker, is a notion that palliative care is not just about dealing with someone in their final bleak hours, but it's the notion of an integrated health strategy that is there for the families in their homes, and that it is about not just the alleviation of suffering, but allowing the individual to have a higher quality of life than they might have otherwise had, and also assures the support for the family and community members and loved ones who sometimes face an extremely traumatic time. The fact that we're having this debate today at the end of the National Health Accord, I think is very timely, Mr. Speaker. The New Democrats believe, and we believe this since our founding, since the days of Tommy Douglas, that the federal government has an important role to play, not in the delivery of service, but working with the provinces and the territories to establish norms across this country. And if we look at the situation with an aging population, and we look at questions of an increasingly frayed health system and the end of the health accord, where less and less money every year will be now delivered into the regions and rural regions and populations that are aging, the need to ensure an integrated strategy of healthcare becomes incredibly important. So what does this look like, this strategy? Well, Mr. Speaker, we know that Parliament had played a role before. In 2007, the Conservative government cancelled the Palliative Care Secretariat that had been established and was beginning to do work in terms of this national vision. We had the all-party committee that came back and said we needed a strategy. But what we're seeing across the country is a real patchwork of services. Right now, there's only, I believe, Mr. Speaker, 4 provinces that even have a provincial strategy in place for palliative care. We see in some areas where there's incredibly strong resources. For example, downtown Regina and Saskatoon have extraordinary services. But even in a city as big as the GTA or Montreal, we're dealing with the patchwork. In rural areas, sometimes it's almost non-existent, but there's a belief that somehow palliative care is volunteers. It's done with volunteer money. And that, Mr. Speaker, I think is not really understanding the importance that it plays. If you look at the delivery of services in the rural regions, I have seen in my own region when families don't have access to proper support, people end up, it causes immense stress on the patient. I see and many times I've dealt with this in terms of people coming to my office where an elderly woman is trying to bathe her husband who's dying of cancer. They haven't been identified as palliative, and they're trying to get home support workers, and the home support workers do extraordinary work, but trying to get them to get an overall vision that this is a palliative issue as opposed to just someone who needs home support. Too often, the person ends up in a merge, waiting for a bed. And it's a locum or the merge doctor who has to tell them that they're actually suffering from an incurable illness, which can be very traumatic. I've seen families almost tear each other apart because of the pressure of someone has to stay home with the loved one. We know that at least in a quarter of the cases of Canadians have said that they have had to miss upwards of a month of work or use personal savings to look after a loved one who is in an incurable situation. In areas where we have good palliative care, we actually can save about $8,000, $10,000 per patient because they're not being moved in emergency wards. They're not, there's not the struggle to find beds, but there's been a whole approach. In my region in rural Northern Ontario, in the rural region I represent, the provincial allocation for palliative care for a region that's over 100 kilometers, that has 3 hospitals and about 20 communities, is $70,000. That's right, $70,000. What can you buy with $70,000 when you're delivering health care, when you're having to do the audits, when you're having to insure travel? Now, that's not to say that's the only money. There's the province, through their LINs, has a pain management program, but it's not under the palliative program. It's through someone else and through another organization that could be 200 or 400 kilometers away. Now, they do good work as well, but it's not integrated. We have personal support workers, but they're not working with necessarily under the palliative network. To get that $70,000, the local organizations are supposed to raise $25,000. So already they're having to bring forward about a quarter of the money themselves. Meanwhile, there's numerous other agencies all delivering fragments of the service. But if you put those fragments together into a cohesive whole, you're going to get better health outcomes. And so we can learn from each other in different parts of the country. And I think this is a really important opportunity, Mr. Speaker. If you talk to the medical front line, and you talk to the social workers, and you talk to the people who are dealing with the sick and the aging, they understand that if we work together and worked on the models that work, we can learn from each other and deliver better outcomes. Monsieur le Président, le besoin d'établir cette programme.
This is a way of weakening the program, and this is obvious. The services are excellent, and in other places they're practically inexistent. Palliative care of high quality and integrated care, including home care, medical care, can provide the care needed to improve the quality of life and the emotional and psychological support needed, as well as support to families. Right now, Mr. Speaker, fewer than 30% of Canadians have access to high-quality palliative care. The NDP therefore call on the other parties to work with us to support this vision for a pan-Canadian strategy in order to help patients and help families. We can use the same model in both urban and rural areas.
The moment when all parliamentarians come together in a positive way, we all have to face the death of a loved one. We have all faced it. We have all have our own stories. These are moments in the life of a family that are crossroads. They're the closing of one chapter and the opening of another. And I remember when my grandfather died, and the responsibilities, the cultural, the leadership roles, the spiritual roles that people play in a family when someone leaves and the next generation has to take that on. That is an extraordinary moment in the life of a family. But if it happens in a crisis unit, if it happens in an emergency ward, if it happens because some of the family members have to be out working in the oil patch and they can't get back and they can't be there, the sense of guilt and the sense of anger can be something that tears families apart or seriously damages the spiritual vitality of a family or community. I think it's incumbent upon us to say, when there's a better model out there, a model that saves money, a model that ensures better access for individuals, it is incumbent upon us to say, let us embrace this model and let's show that dying with dignity in 2014 should be about ensuring that we have everything that's in place around the person, around their loved ones, around their family, so that they can make that transition, and that we, as their family members and loved ones, will also be able to make that transition to the next level of our own community. So I'm hoping to get the full support of the members of this Parliament. I certainly am counting on the members who did the extraordinary work on the Palliative Care Committee. I think this is something that we can all agree on, and I'd like to ask my colleagues to work with us to support this motion and then begin to push for its full implementation. And from this Parliament, it is incumbent upon us as well to go and begin this discussion in Canadian society. This is a common sense solution that's staring Canadians in the face, Mr. Speaker. This is a discussion that we need as Canadians. It is a positive discussion. It's a discussion that brings people in to talk together as opposed to leaving people on the outside. So I'd like to think that out of this motion can begin a discussion that is positive across this country. Thank you very much.
Questions and